I'm going to turn it over to you.
Thank you so much, Tricia and Elizabeth, for having me and inviting me here tonight to speak with all of you about this really critical issue. I really value this opportunity to talk to you all about these critical things. And so I'm going to actually share my screen and pull up some slides to talk through some items, because that'll be more fun to talk about with the video. And I will try to see your faces as well. So we're going to talk a little, as Tricia said, we're going to talk a little bit about health inequities in our community, and especially what's driving at those health inequities. And so first, I want to tell you all a story about the Jefferson Memorial. I can't see all of your videos, but I would ask a show of hands of who's been to the Jefferson Memorial right across the river from us. Hopefully many of you, it's beautiful. So a few decades ago, Park Service staff for the US Park Service noticed that some of the infrastructure of the Jefferson Memorial was crumbling. And it actually started becoming a safety problem because pieces of the ceiling were falling. It could hurt tourists. It was a real issue. And so they saw that, you know, there's something happening here. There's something wrong that is very obvious, and we need to figure out how we solve this problem. So first they asked, well, why is it crumbling? Like, why is this happening? And the answer that they got was, well, we're washing it nearly almost every day. And washing it uses a lot of water. It uses a lot of harsh chemicals, which leach into the stones that make it more likely that the infrastructure will crumble. Now, what often happens in regular problem solving in the world is we would stop right there and we would say, okay, let's switch out the chemicals for what we're washing it with. Let's just use a different sort of soap. And that's what we're going to do. But luckily, the people working on this problem said, well, hang on a second. Why are they washing it nearly every day? Like, how could it be getting this dirty to be washing it every day? And they learned that, well, they have a serious pigeon issue, and they are leaving their droppings all over the memorial. And so we have to keep scrubbing it down to keep it nice and pristine. For the tourists that are coming by. So again, they could have just said, well, we're just going to chase away these birds every day and then, you know, problem solved. But luckily, they wanted to get to the root cause. So they brought in a pigeon expert, and they said, hey, pigeon expert, why are there so many pigeons at this memorial? And the pigeon expert said, well, that's because you have a ton of spiders here. And these pigeons love to eat all these spiders that are hanging out at this memorial. And being the great thinkers that they are, rather than just trying to exterminate all the spiders, they brought in a spider expert. And they said, spider expert, why are there so many spiders hanging out at this Jefferson Memorial? And the spider expert said, well, you have this species of insect, this midge, that likes to hang out here, and they mate at a certain time and they die. And the spiders know that it's the great ground for them to eat these midges. So the spiders come to eat the insects, the pigeons come to eat the spiders, the pigeons leave their droppings, and there's a ton of cleaning that happens. So then, of course, what do they do next? They bring in the midge expert and they say, why are all these insects hanging out here? And what they discovered was that the timing of the lights that turn on at the Jefferson Memorial is the special dusk lighting that turns on that is really attractive for these midges, for them to come out and breed. And right after they mate at that beautiful dusk lighting at the Jefferson Memorial, they die. And that's when the spiders know to eat them, when the pigeons know to go eat the spiders, when they leave their mess for it to be cleaned. So the resolution was, all right, so we need to change the lighting sequence for how we do things here to solve this problem, which is what they ended up doing to be able to get to the root cause of the issue that was happening and be able to solve that. Now, I wish I could tell you that it was a super easy sell and that they changed the lights and everything was hunky-dory, but there were a lot of challenges to even get the lights fixed, because people said, well, how are we going to get these beautiful pictures if the lights aren't on at night? And so there were a lot of battles to try to make that challenge happen. But the great news and the moral of this story is that they got to the heart of the problem, rather than just seeing that top layer of like, well, this is the surface level problem, and we're just going to attack it right at that surface. They kept digging and digging and asking why, and bringing in experts and specialists and looking at the data and combing through until they truly discovered what was happening so that they could find a systemic solution to the issue. So I tell you all of that to say, what is Alexandria's metaphorical crumbling monument? Well, this is a map of our city in census tracts, and it is that life expectancy numbers that Tricia referenced, that 8-year difference in life expectancy. And so when we look at this and we see instances where we have, even on the other side of a street, right, on the other side of King Street, from this Braddock Road area to the more central Alexandria area, we see this big gap in life expectancy. We know that that is a problem. And those are kind of the red flags that should have all of us saying, what is going on here? What is the problem? How do we resolve this issue? So what the health department does, which what many health departments do, is we conducted a community health assessment. And that looks at a number of things. But first, we need to start with our common definitions of how we start exploring these issues and challenges. So the first definition that I want us all to get on the same page with is health equity. And what that means is when everyone in the community has the opportunity to attain their highest level of health and well-being. So this is different from equality, which is when everyone gets the same. Equity is really about people being able to get what they need to be able to succeed. So that might look a little bit different for each person. Now, health disparities are when there's a difference in health status between a few groups of people. So when we have demographics or other things that we can look at and say, well, this group is experiencing this, and this group over here is experiencing this. That's when we would see the difference between those and know that there is something that we need to address, to look at. So how do we actually get our heads around the scale of this problem? How do we even know what our issue is? So we conduct community health assessments to explore a number of things. So it's kind of the, if you know the journalism questions, the who, what, where, why, it's kind of like that for health assessments as well, where what we're looking for is what are the biggest health challenges, who is most affected by them, where in our city are the unmet needs for services, and really importantly, why is this happening? Why are there those health inequities? They do not just come out of nowhere. They happen for a reason, and what we'll soon see is that many of them have had the ground laid for them over decades and decades of really intentional choices. And so that's the hard part. That's the part that we have to work to undo those things. So after we conducted, we conducted our community health assessment, we did a really large survey in our community, and we asked our community a few things. I'm just highlighting one of the questions that we asked, but we asked, what are the top strengths in our community? We asked, what are the top health issues? And what would most improve the quality of life in our community? So these were the top results of that survey. We had almost, I think, 1,800 responses of survey responses from across the community, of every demographic, every income level, every corner of the community. We had people filling out these surveys. We set up pop-up survey takers outside of grocery stores, at recreation centers, at libraries, at festivals, at churches. We just showed up all over the place to be able to get answers to these questions from people. And you can see that what we saw was a wide variety of things. We saw that the number one answer by a long shot was mental health problems, which includes depression, anxiety, stress, and suicide. And I want to caveat this by noting that this all happened in the fall of 2018. Now that we are in this COVID world, we may have some different responses, right? But this was this pre-COVID assessment. Number 2 is alcohol and drug use. And then interestingly, number 3 is differences in health outcomes for different groups of people. So essentially the community recognizing that health disparities and inequities is a very real thing in Alexandria. Now, some people might be surprised to see violence and abuse was number 4, then obesity, aging-related health concerns, and on and on. So this is kind of what the overall kind of top line data shows us. But being good public health people, we don't just stop at the very top level data. We have to dig deeper and keep looking further at the data to see, well, is this the case for everyone? Or do different people respond to this survey in different ways? So we looked at responses by zip code. So you can see these are the responses that we got of that same question that I just showed you, but by different zip codes in Alexandria. And you can see that there are definitely differences based on where you live. So for example, the clearest one is that in 22312, the top answer was dental problems. That wasn't even in the top 5 in the overall survey, but for 22312, that is the number 1 issue. Similarly, teen pregnancy is number 3 in 22312, whereas it was not in the top 5 for the overall, and it doesn't even make an appearance in most of the other zip codes that we look at here. So that's when we start to think, oh, what's happening there? What can we do to better support people who live in this area? Does this mean, are there gaps in service that we need to consider? Is this a socioeconomic issue? What is happening that would cause kind of these differences in responses based in zip code? You can also see, some different other things shifting around with the zip codes. And so now I want to talk a little bit about some more in the depth about the community health assessment, is that it not only asked questions of the community to get their take and their perspective, that kind of qualitative data asking people about their experience, but we also did a ton of research into the data. So the objective facts about what is going on in our community. And what we found is that unsurprisingly, there are a ton of health disparities in Alexandria. So I have a few listed out to talk about. One is that, for example, residents who live in our West End, and specifically 22304, have the highest rate of adult asthma hospitalizations, which is a quite high number, 10 per 10,000 people, while people who live in the central area of Alexandria have the lowest rate, 2.9 per every 10,000 people. Now, being hospitalized for asthma, that's a preventable issue, right? That's something that with the right environmental conditions, the right access to the needs and to the care can be prevented. These do not have to be happening. And so that's really also when we start thinking about, well, what is going on in the West End and in Central Alexandria so that we can see what needs to happen to support our residents better. We also saw really stark statistics like the fact that even though our Black or African American residents have the same rates of cancer diagnosis as white residents, the Black or African American residents are more likely to actually die from that same cancer compared to the white residents. We also saw even, differences between different genders in terms of health issues. So, we saw that males have 3 times the suicide rate of females. 3 times the suicide rate. It's an extremely big number. However, interestingly, females were actually hospitalized for self-harm at twice the rate of males. And so here are just 3 examples of disparities based on location, right? Your zip code, based on your race or ethnicity, and then also based on gender or sex. So there are tons and tons of more examples of the disparities that we have in our community, but I just wanted to kind of highlight that, here's an example of, things that we saw really clearly that, there could be action taken on, and helps us to be able to focus our efforts where it is most needed and where we can leverage and do the most good. All right, so we collected all this data. What are we going to do with all this data, right? We're not just going to stick it on a shelf and say, well, that's interesting, that's unfortunate, but we needed to take action. And so part of our work after our community health assessment is to develop a 5-year community health improvement plan. And it's really important to note that it is a community health improvement plan. It is not the Alexandria Health Department health improvement plan. It is not another organization health improvement plan. It is a community health improvement plan. And the reason that that is so important is because we were not the sole decision makers for all the things that are coming in this plan. So the Alexandria Health Department works really closely with an organization called the Partnership for a Healthier Alexandria, which is a coalition of nonprofits and other groups. And together we are facilitating this process, and we brought a lot of community members together. We shared the data with them about what was going on, about the top 10 health issues that we saw in Alexandria, and we asked them to vote. We asked them to decide which 3 of these 10 health issues in Alexandria should we be focused on for a 5-year plan. And the community selected these 3. They selected mental health, affordable and healthy housing, and economic security, or, addressing poverty issues. And sometimes people are really surprised that in a community health plan, we are dealing with housing and poverty and economic security, but we simply can't have a healthy community without these things. And I think especially during COVID, it really just reinforces all of these issues, right? What is the most common advice that we've given throughout the pandemic? Stay home, right? How can you stay home if you live in extremely crowded housing, if you live in unhealthy housing that's full of black mold, or you don't have the proper heat or air to be able to do so? You're sharing it with multiple families because you can't afford otherwise, or you might have recently gotten evicted. How can you stay home if you have a job that doesn't allow you to telework, right? That doesn't have that remote access, and you work at one of our frontline essential worker positions, right? Like our grocery store workers, our postal workers, our public transit folks, our childcare providers, people who are on the front lines that may not have sick leave even, or health insurance, right? And so how can they follow the guidance to stop the spread of a global pandemic when they do not have the ability to take care of themselves and their families, to protect themselves from this infectious disease? So, just being able to see that, these were the right choices for this 5-year plan, even with COVID. So now we need to figure out, well, how do we develop solutions to these really big, massive issues, right? Where do we start? So this looks really intimidating. This is a big fishbone chart, is what we call it. And this is really getting at those root causes. So this is our breakdown of the Jefferson Memorial, right? This is where we look to see where are the spiders coming from, where are the pigeons coming from, where are the droppings coming from. This is where we start to break down a little further to see what is happening. So this one in particular is about housing. Now, the yellow highlights are actually items that community members raised in one specific meeting that they, specifically called out. But what you can see, I'm trying to move my little video boxes around, the issue, the problem that we were trying to get at the root for this particular topic was the fact that paying the rent or mortgage is a worry or serious concern for more than a third of Alexandrians. More than a third of Alexandrians are worried about how they are going to pay their rent or mortgage every month. That is a huge number. And sometimes we kind of miss these concerns because overall, Alexandria is a really wealthy city, right? We have a very high area median income. I think it's about $90-something thousand a year. But we have a ton of people that are making well below that. And even people who are making close to that, their housing is really, really expensive. So it eats up a lot of their income. And so thinking, again, one way that we could have solved that problem is we could just say, okay, every Alexandrian is going to get money to pay their rent or mortgage, right? Like we could have just given them that, or, even easier, we could have just given them some mental health counseling to deal with the concern part, right? To deal with the stress of paying for it. That would be the most top line solution. But the harder work, the deeper work happens when we claw back and we see what's contributing to really expensive and sometimes unsafe housing. So one is that you'll see kind of throughout this fishbone are things like, zoning regulations and the fact that, we have certain parts of our city that are zoned for certain types of housing, right? So there are limitations to how you can construct new and additional affordable housing. There are also things like the fact that many consider Virginia laws to be landlord-friendly versus being tenant-friendly laws, which means it's a lot easier to evict people than it is to be able to, support them and keep them in their homes. And there are things like the fact that there is a lot of lack of awareness about even the existing resources. So Alexandria is really lucky that we do have a ton of resources and supports in our community, but not everyone actually knows about them. And the people that know about them might be even afraid to access them, partially because of documentation issues for some of our immigrant communities. There's a stigma for a lot of people about, not needing to depend on anyone. And so they don't want to reach out for that help because they were always taught that, I need to do this myself. I need to pull myself up by my bootstraps and just, if I can't do it, it's on me. It's my fault. So there are a lot of kind of challenges there. Now, I don't know, maybe you all will discuss maybe in your next meeting a little bit more about the history of a lot of housing challenges, including redlining and some of the other things that have led to racial discrimination and segregation within our community. I'm assuming maybe you'll talk about that at your next session about housing. So I won't get into too deep about that. But I want to note that a lot of these things, again, are not necessarily accidents. Like they didn't just turn out this way. They came about, for specific reasons. And partially it's because of systemic racism that led to this. So for example, for housing in particular, there are many instances, there's a lot of evidence now kind of looking back at the 2008 housing crisis and everything that went on there that we know was a lot driven by banks selling subprime mortgages to people who maybe couldn't, take on these larger mortgages, but they were selling them in a way that was extremely predatory and really trying to get people to get these loans that maybe didn't make sense for them, but they said, oh, you can take on all this credit. It'll be fine. You've got this. And they specifically targeted people of color to do this and to sell them and bundle them, which led to, when the market crashed, led to a lot more people of color who lost their homes or had to default on loans or any of those other challenges that can really scar you for a long time, both your credit as well as, you know, your mental health to deal with that stress and what's going on. And so there are examples of that. That's just pretty recent, right? I think a lot of times we think of some of these systemic issues as being way back in the day and far back history. But I mean, that was 2007, right? And there's plenty of other examples that we can pull from and look at that are really recent too. So I think that's really critical to highlight. Even another example that's not exactly housing, but it's more about our environment and our conditions, is that if you spend time driving around the city in Alexandria, you'll notice that there are a lot of stark and kind of odd differences when it comes to trees in our city. So just think about that as you're kind of driving through neighborhoods. Just kind of consider, where are there these beautiful tree-lined streets in our community, and where are there maybe not those things? And what you'll know is that there are some correlations with kind of areas that have been historically, you know, dominated by people of color. So for example, south of Duke Street, there's a number of housing developments that were predominantly for people of color. And there is a striking lack of trees there, which is kind of part of this environmental justice issue. And which like seems like, well, why is that an issue, right? Like, yeah, it's not as pretty, but like, how does that actually hurt your health? Well, a few things. In the summer, if you've ever been in a place without many trees and there's just concrete everywhere, it can be up to 10 degrees hotter in those areas versus other parts of a city that have a lot of trees and shade. So what happens when it's hotter? You have to crank your AC to be able to meet that same cooling inside your house. And so people who live in those areas without those trees, with the hotter houses, have higher AC bills to try to keep up and get that same level of cooling. And higher AC bills put more pressure on your economic status, which just kind of perpetuates this cycle of economic inequality. So I know it sounds kind of odd thinking about trees and how that fits into this whole system of justice. But that's one of those things that maybe we have control of, right? Are there some things that we can do in that front rather than just helping people pay their utility bills? Is there something that we can do to get at that system level to make it not an issue for people in our community? So food for thought there that we'll get back to. So next, that was housing. Let's talk more about economic security, as I was just talking about. So before COVID, we did not really have an unemployment issue in Alexandria. We had a significant underemployment issue, which means that we have a lot of people who are working in jobs that pay them less than they deserve to be paid because they have higher degrees or they have additional training, but they just settled for a job that, you know, earned less than they maybe could have. They are working more than one job. They're trying to figure out how they can make ends meet, which is a real challenge. Unfortunately, after the pandemic and during this pandemic, you know, we did start to see an unemployment issue, which means that we have to shift our strategies and figure out what that looks like. But when we look at economic security, we look at a lot of things. So we do look at income itself and the actual jobs that people have that you can see kind of in the income itself. So the fact that we have tons of service jobs in Alexandria with very limited amounts, of upward mobility or benefits. It's actually something that we hear really often at the health department right now when we're scheduling vaccine appointments is, well, I can't make it during the day to go to a vaccine appointment. I'm not going to get paid for that time, so I can't go during the day. Is there anything on the weekends or the evenings? My employer won't let me go during the day, which is like heartbreaking that we have to kind of work these workarounds to figure out how we can get someone a life-saving vaccine because they're paid an hourly wage, and they're scared that that difference might mean that they can't put food on the table. No one should ever be put in that position where they have to make those hard choices about that sort of thing. But beyond even the jobs, we have to think about these other factors. So how do we actually build wealth too, which is a large part of how people kind of pass money onto their kids so that their kids have a better life than they did, which is, I think, what most people want, right? They want to have their kids have a better life than they do if they choose to have kids. And so those things that contribute to the ability to do that sometimes don't work out for people. For example, in our country, because our healthcare system is a mess, there are lots of cases of medical bankruptcy. It is one of the most common reasons for people to go bankrupt is because of medical bills. Even for people who have health insurance, they still go bankrupt because of the systems and because their insurance doesn't cover things that they desperately need to have, right? These aren't elective surgeries. People sometimes get bills of $10,000 or higher for pregnancy and for delivering babies. And I mentioned too, kind of the predatory lenders. It's another thing to consider when looking or driving around our community is where are payday lenders located in our city? There's not a lot of payday lenders hanging out in Delray. I can guarantee you that. But they are in our west end of Alexandria. They are in our Landria. They are specifically located in places where there are folks who are lower income. And if you get sucked into payday lenders because you need to do something to support yourself or your family, your car breaks down and you can't get to work, you have an emergency, you need to deal with it, you get stuck in this cycle where you could be charged upwards of hundreds of percents on the interest of this payday loan, which traps you in this cycle of constantly owing more and more debt. There's also kind of along with that is community banking, right? Like where are those things located? And so thinking about, where do we place these items in our community to create the conditions and the environment that helps our community members succeed and have that access to that opportunity for themselves. So it's a lot of factors here that we could go more in depth with. I feel like I could talk about this for hours and no one wants that. So I'm going to move on to mental health. So the next issue that we are trying to work towards here was the fact that 1 in 5 adults experience 5 or more days of poor mental health, as they've described it. And there are a ton of contributing factors to this as well, right? There's the stigma piece, as well as the toxic stress that comes in for a lot of people. And especially now with COVID, I think a lot more people are experiencing this daily toxic stress that doesn't just stick in your brain, it affects your whole body physically. You feel bad, you feel physically the effects of stress. Part of that is from, previous trauma. Some of it is this line that I have here, the isms. So for example, for people of color that experience a whole extra layer of the racism and things that they encounter while dealing with all these other issues adds this extra layer of stress to the things that are going on. For example, and since we're talking, a lot about health, there have been multiple studies about this, and I just want to highlight one from 2016, again, super, super recent, that there was a study of medical students, and they wanted to explore their attitudes about treating different patients. And a whopping about 70% of them said that their Black or African American patients have a higher pain tolerance than their white patients. And what that means when it comes to actually practicing medicine is that they are probably less likely to prescribe pain medication, probably less likely to prescribe additional procedures, looking at things. There have been studies that show that they take, heart conditions less seriously because of this false idea that somehow Black or African American patients have thicker skin or lower, nerve sensitivity that comes from, way back when, this false pseudoscience that people basically used to justify why they could treat people of color poorly, right? Because they said, well, they can take it. They've got tougher skin. They're not feeling the pain as much. So they made up these rationales, which was all totally made up, but to try to justify this bad behavior. But it carries through it to 2016. That is so recent. It is really horrifying to see that sort of thing. There's also data that Black patients and Latinx patients are less likely to be admitted to the hospital than white patients when they present in emergency rooms, or less likely to be given access to like a cardiac specialist when they present with heart issues. All of those sorts of things contribute to things like that stat I mentioned about how our Black or African American residents are more likely to die of cancer, even though they get it at the same rate as white residents. So all these things kind of fold in together. And similarly, again, back to this mental health, there's a lot of contributing factors to poor mental health. A lot of people talk about stigma. There's also the access to care. There's so many equity issues within access to care. Even if you have health insurance, right? Even if you have good health insurance, finding a mental health provider that actually is still on your insurance list, that has an opening, that does not, when you call them, they don't say, oh, I actually decided I don't want to be in network anymore, but I'll charge you $200 a visit. It's nearly impossible for people even who have health insurance. So people without it, it's really tough. So I've talked a lot about some kind of depressing things, right? Like some of this stuff is really hard to kind of reconcile with what we know and love about our community. And it sounds like there's a lot of bad stuff happening, but the good news is that we have a ton of potential to do really great work. And thinking about it, like, how do we do that work that gets those solutions at that root, at the really deep part to fix the system? So we're not just patching over things, right? We're not just switching out our cleaning chemicals for a more eco-friendly version. We're actually changing the lights at the memorial to figure out the solution. So one way are through policy work. So I have a few examples up here. So one are like those zoning changes that could happen. For example, I can share something that recently occurred as a result of our community health improvement plan work, is that recently the city council approved a zoning change that would allow healthcare uses in residential areas, which means that now there could be apartment buildings in residential areas that their bottom floor, you know how there's sometimes like little markets or little restaurants at the bottom floors of apartments. Now there could potentially be like a clinic that is there for people to access and be able to use in their own neighborhood, right? And when we look at places like that 22314 zip code that said dental issues was a big thing, maybe they could have a cool dental clinic at the bottom of an apartment building. The door is open to now these possibilities to thinking about that because of a policy change from city council, because the community requested it. The community said, we want this. We put it in our plan. We shared it with the city and city council, and they made that happen. So people's words, the community's voices really do make a difference. Another possible policy change are things like eligibility requirements for public programs. Like I mentioned before, there are a ton of resources in Alexandria, but not everyone can actually access them. So a lot of times there's a lot of documentation proof that's needed to be able to access these, which is sometimes very scary for some of our immigrant populations or some of our even non-immigrant populations that don't necessarily trust government to be able to do things. And so thinking about what eligibility is actually required to qualify for some of these things and really reconsider, does this policy have to be this way? And then another one, living wage laws, thinking about, again, that root cause and the economic insecurity. How can we support people to be able to actually afford to live in our beautiful community? And then systems. So thinking about things like, how do we change the processes that we have going on in our community? So for example, we know that within our school system, there are significant differences in terms of which students have been selected for the talented and gifted, the TAG programs at ACPS. And so thinking about, well, what are actually the identification processes that are in our schools to help people get in that way? If it's based on whose parents can advocate the loudest, it's predominantly going to support our white residents because they know more of the systems and they know who to advocate to. And unfortunately, and this is a real challenge that I think we all have a responsibility to address, is that most of our city government, not just in Alexandria, but in most places across the US, is based on a complaint-based system, right? So it's people who know who to complain to, or call or email or message on social media, who know which triggers to pull or levers to pull, make things happen, right? And so for our residents that don't know who those people are to call or who to email or who to text or to do all those things, they just kind of hang back and they wait for things to happen, or they reach out to people, but maybe it's not in the right way to be able to make change happen. So we need to think about, why should our systems be focused on complaints and waiting to hear about when things go wrong versus having a system that more proactively looks at equity and how to make change happen in our community? And so again, my example of tree canopy, which is, seems silly, but thinking about, we have this eco-friendly goal in our community of increasing our tree canopy. So maybe rather than just having that equal distribution, we have where everyone gets the same, we have this equitable solution where we look at parts of our city that maybe don't have as many trees, and we focus there when we're expanding our canopy. And then the last big thing and bucket here is the civic activism, where you all can have such an incredible impact. And I really can't stress this enough. Part of the way that we make change happen in the city are by, activity on our various boards and commissions. I think we have something like 80 boards and commissions, and making sure that we have diverse representation on those boards and commissions. And, being able to speak out at city council meetings when these issues come up for debate. It's not always fun to wait on those city council meetings until it's the agenda time to speak, but city council members really listen. They really take the feedback from the community very seriously. And especially if there is a concerted effort from a group of people that all are saying, we want this policy done, or we need this change, they will hear it and they will listen to it. And similarly, obviously voting, really critical. And a few of these last things here that are so important. The nothing about us without us. So this is really how we make equitable solutions, is that we can't do things on behalf of others. And I think it's kind of this mental shift when we even think about things like charity, and it's that people are not charity, right? We are not pitying them and treating them as charity. How are we investing in our community members to support them so that they can have that best opportunity for themselves? And so it's really also about not just making decisions about how we help kind of the other people, but it's bringing them into the fold and saying, what can we do together about this issue? How do you see the solution? How do you see the issue? How can we work together to solve this? And that's why that last piece that is highlighted and bold and capitalized and underlined is shared power. That is truly, I think, the bottom line for health department work from us. And I hope it becomes the work for everyone, is that decision making can't just be from the top down. It can't be unilateral. And sometimes sharing your power and giving other people, that decision-making capacity, that shared decision-making is really scary and uncomfortable, because sometimes the decision isn't necessarily what you would have made. But part of it is that you build trust, and you have to also trust people's lived experiences, and that, people know the things that they need to solve their issue. And so by sharing the decision-making power, by working with the most affected community members, which through many of the issues that I've discussed are our residents of color, this is how we make really sustainable, systemic change to be productive. And, again, we're not just changing out the chemical solutions for washing the memorial. We are looking at the true issues. We are changing policy, and we are getting at the root to make all of our communities stronger and healthier. So I think that is it. I'm happy to talk about any of this stuff or answer your questions. And I hope you guys are excited about all the change you're going to make in Alexandria.
Thank you. I'm trying to, there we go. We'd love questions too from folks. And you can put them in the chat if anyone has questions to ask. I'd be interested to know, how do you go about making sure that your efforts, like just speaking about vaccines, since you're really involved in that, how do you make sure that they're equitable, like the distribution of vaccines and that sort of thing?
Yeah, so it takes a lot of different factors to consider. Some of it is that we, like I talked about, we use data a lot. And so we already know our zip codes and our areas of the community that is experiencing the highest burden of COVID cases. Every month we put out an analysis about where our biggest COVID cases are happening. And so we already knew going into getting the vaccine where we needed to support and be more proactive about helping people and helping them pre-register for vaccine. So we do a lot of kind of focused outreach and education to be able to support those communities. And for example, sometimes we have to be a little bit creative about that outreach. So for example, this week, and Trisha was really helpful in this project this week, so I'm very grateful for her. We actually, since grocery store workers are eligible right now for a vaccine, we did a volunteer outreach project where we created these packets of educational materials about the vaccine in multiple languages, including how do you sign up for the vaccine. And we actually have volunteers going out this week, starting today, to about 160 different locations around the city, literally dropping off packets of information for people so that they know how to get access to this. Because I think otherwise, you otherwise have to assume, well, everyone follows the city's press releases and social media, which we know that they don't, right? A lot of people do not. Similarly, we worked really, and continue to work really closely with Senior Services of Alexandria and the Division of Aging to do a lot of proactive outreach to our seniors, like the ones that they serve who get Meals on Wheels and groceries to go, to see if they would be interested in vaccine. And we actually worked closely with Senior Services so that they could even register some of their folks for appointments directly to get them those access, because they are at highest risk of severe disease and death. And so I think the way that we do it equitably, to summarize, the way that we do that equitably is we look at the data of where our people are that might be disproportionately harmed by COVID. And then we work with community partners and do different outreach and education strategies to make sure everyone knows how to access the vaccine, so that, lack of knowledge about it is not the barrier for them to get vaccinated.
We have a great question for the church folks here from Dorothy. What do you think the faith community can do to help with these efforts?
So much. First, I will start with the vaccines because I just talked about that. So what every single person can do when it comes to supporting vaccine efforts is that when you are talking to your friends, your family, your neighbor, a random person that you see at the grocery store, just ask, hey, have you pre-registered for a vaccine yet? It's super easy. You just go to this website and pre-register. That should be part of all of your conversations. It's certainly part of all of my conversations. So, just asking people, have you pre-registered for vaccines? If not, can I help you do that? For people that don't have internet or don't feel confident, just help them to fill out the form. It gets them in line for a vaccine when it's available. And that's really critical. When it comes to all this other sort of health work, as we're almost done, we're about to release the Community Health Improvement Plan, and there are so many initiatives in there that require, a citizen voice because they're policy changes. And the way that, again, that those happen are by advocacy and by being able to mobilize and say, yes, we want this change to happen, right? We want zoning changes. We want the city to put more money into affordable housing. We want new policies about, that maybe we should have mold regulations in our city. Whatever it is, there are absolutely policies that people can rally around to be able to support. And it's really hard to ignore a lot of voices calling for policy change. And, we know that there are some churches that have even given up space, right? They've used some of their parking space to turn it into affordable housing, which is pretty amazing in Alexandria. So that's kind of like one extreme example, but it's pretty amazing. But then there's the advocacy efforts. There are things that you can continue to champion and work towards changing these systems that will have effects, that will range for decades after the policy has happened. So there's some great things there.
Thank you. So from Catherine, is change more related to reallocating city funds or to devising actual programs and person-to-person help for disenfranchised people?
So that's a good question. So I think it's both. Both things are necessary to be able to happen. I mean, programs are critical, right? Like we don't want to leave people hungry. We don't want to leave people out in the cold for the evening. But when we think about how we spend our city budget and those funds and like where we make those investments, again, those are kind of those longer term solutions that help make, longer term change happen. So it's kind of like thinking about, well, are we going to invest in a new program that we spend, X number of dollars, for example, that we, have more food drives? Or do we use that same bucket of money and, we work on, policy laws or things like that so that more people can afford to go to the grocery store because they get paid more money per hour, right? And so it's kind of thinking about like, do we give the man a fish or do we teach him how to fish? And so kind of looking at what we can do. And a lot of times the answer is we need to do both, right? Like we can't have that person starving today. Like that doesn't serve anyone. But it's simultaneously thinking about, why is that person going hungry in the first place? Is it because of a lack of job opportunities, training opportunities? Is it the fact that they have trouble getting to a grocery store? We know this is kind of off the side, but there are a number of sidewalk gaps in our city. If in terms of there are parts of our city where there's literally no sidewalk, it just ends and it's really unpleasant to walk through. For example, there's an area on Van Dorn that's right by the freeway where just that whole other side of the street has no sidewalks. And if you are someone who has to take the bus or you walk a lot, it is really unpleasant to carry grocery bags and other things across an area that doesn't have good sidewalks, especially if you have children and you also have a stroller or you require, a wheelchair or anything like that. So thinking about how do we address those kind of neighborhood conditions to just make everyone's life better, right? Because that doesn't just benefit the people who are disenfranchised. It helps everyone when we have nice sidewalks, right? That means more people are out exercising, enjoying the fresh air, which is good for both your physical and mental health.
So this one feels complicated to me. So on the economic portion of community health, is employment more important than available financing resources? Are there any current programs stimulating employment or entrepreneurship?
Oh gosh, that is a complicated question. That's a good question. I like that. So, man, okay. So there are a few pieces of this. First is that we have, as I've mentioned, we have a number of immigrants in our community, right? I know, I'll just share a personal anecdote. I'm a first generation American. My parents came from the former Soviet Union, and because they couldn't bring their college degrees with them, my dad didn't finish college, but my mom couldn't take her degree over because that's what communism did at the time. And they had to leave because of anti-Semitism there. And so coming to the US, not having an education, not speaking very good English, it's really hard to join the workforce and be able to set yourself up in a way for success. And so what my family did and what a lot of immigrants do is they start businesses, right? They start their businesses because that doesn't necessarily require a degree, a specific degree to be able to do that. And there are some really cool organizations, even in our area, like I'm butchering their acronym, the ECDC, but the Ethiopian Community Development Corporation, that supports like microfinance to support entrepreneurship, especially for some of our African immigrants that come to the US and want to start their own business. And right now, the city is investing in a lot of small business support, especially during the pandemic, to keep a lot of our small businesses supported when economic activity kind of shut down, during this time. So I think that definitely supporting entrepreneurial efforts, like, for small businesses to be able to help people grow and be able to support their own part is really critical. But I think that there's also a ton of opportunity to make sure that, just because we have jobs isn't good enough, right? We also want to make sure that they are good jobs in that they ideally offer some paid time off, some sick leave, some health insurance to be able to cover people, which, is kind of a lofty goal. I know some of those small businesses certainly can't afford to do that, right? But, where we can we be able to support the jobs that we do have to really, work for our community members as well? So probably didn't satisfy all the parts of that question, but hopefully that helped.
So one more, and then we'll do breakup rooms to have a little chatting time. But are there specific regulations that can be instituted that will help the health and welfare of the community of color?
Yeah, so I think that some of these things are really trying to make sure that some of it is less about kind of new things and more kind of undoing the existing things, if that makes sense. So, right. So like looking at what are the existing policies and regulations on the books that we have that are perpetuating systemic racism. There are some really great experts on this, like Ibram Kendi, who says that policies can either be racist or anti-racist. There's nothing in the middle. You're either making it worse or you're making it better. And so I think there is that consideration of, is what we're looking at our community level making things worse, or are they making them better? And so, I think that any sort of policy that supports the economic supports that we just talked about, or thinking about our housing situation, and in terms of increasing affordable housing, for example, one example like that is I know that there are some advocates in our Alexandria, Tenants and Workers United, that, you know, fight for things like more co-op owned housing, right? Being able to have more housing options like that to be able to better support the community. So what are some things that we can do, you know, to support that drive? Or even kind of within our schools, looking at different policies like restorative justice, which is all about, you know, do we necessarily need to suspend kids, take them out of school, make them miss more days of school? Or is there other sort of disciplinary systems that we can use where everyone grows from the situation and kids don't miss out from learning and are taken out of that safer environment? So I think there are policies within our institutions that we can absolutely look at. You know, even things like, I'll just name one more specifically. You know, our hospital, the Inova Alexandria Hospital, is a nonprofit hospital, which means that they are required by law to spend some of the money that they earn back into the community. Now, what they spend that on, I think, can be influenced by residents, right? And so it's about how do we want to support or direct our institutions to spend the resources that they do have, right? So it's about thinking about budgets of institutions and even the city, as well as regulations and things. And I'll just name one more regulation because I just love policy. One more regulation that I kind of alluded to earlier is about safe housing and healthy housing. Right now in Alexandria, if you live in a rental property, if you live in an apartment or something like that, and you have like black mold in your house, like really dangerous stuff that aggravates your asthma, that gives you headaches, that makes it really hard to live, there is no law that your landlord has to do anything about it. If you call the city, they will give you a pamphlet on how to clean the molds yourself, which, as we know from About Mold, if any of you have had mold issues, is that you can't just wipe it away and it's gone forever. It'll come back until you address the leaking issue or whatever it is that's actually causing the mold to accumulate. But you can't necessarily force your landlord to do that. And so thinking about, well, who lives in our higher concentrations of rental properties that are lower income and maybe have less power to hire a lawyer to fight their landlord about mold issues? It's not our lower income residents of color, right? And so thinking about what can we do to better support those folks so that they don't have to fight, so that it's just built into our system that they are protected and that they live in healthy places. So that's just another example. So, and I'll stop on that.
Thank you. I am so thankful for all that you've given us to think about tonight. And especially you've really queued us up for the next subjects that are coming and the ways that you've tied in all these other pieces. So it's really, I feel like we've gotten a really holistic look at so many problems that exist, from the very small to the large. I'm so thankful for you, and thankful for Tricia for knowing you and bringing you in to speak to us.